Welcome back to our channel. I'm Dr. Kat Karami, Medical Director of Allurant. Today, I want to talk about microneedling. It is almost synonymous with taking care of your skin, and it's done in so many different varieties by so many kinds of providers. And some people are even doing it at home with different machines that are available for at-home treatment. So the question is, what is microneedling? Do I need it? Do I need to see somebody to get it done? And what are the variations of microneedling? Microneedling is essentially resurfacing the skin by creating mechanical channels in the skin. And it's often confused with radio frequency microneedling, which is a different treatment. It's a device that has radio frequency energy attached to it, and that is delivered via microneedles. I'm going to be talking just about mechanical microneedling. We use Skin Pen, which is a handheld pen that has the microneedles on its head. It's one of two devices that is FDA approved in the US for use in the medical setting for treatment with microneedling. The reason it is FDA approved is because there's no communication of blood and body fluids between the head and the handles, and there's no possibility of transmitting disease between different uses, different patients. The microneedling that can be done with other pens don't have necessarily as smooth a movement in and out of the skin. Also, the needles are not coated and they don't have medical grade penetration and retraction, meaning that they can tear through the skin instead of creating smooth channels. As a result, it can create some scarring and micro scarring that takes away from the tightness and the smoothness that we're trying to accomplish with microneedling. What does microneedling do? Microneedling the skin creates microchannels and therefore stimulates the cells in the skin to start creating more collagen. And as a result of more collagen, the skin gets tighter, the pores get smaller, and oil gland production goes down, means that it creates a smoother surface as well as reduces the acne production and reduces acne scars. It can improve the appearance of fine lines and pigmentation. And microneedling has the great advantage that it can be combined either with products, with your own platelet-rich plasma or platelet-rich fibrin in our clinic, which is when we draw blood, we centrifuge it and extract the plasma with the growth factors and the platelets. That is a really great combo, and it's been nicknamed vampire facial, but essentially it's PRP plus microneedling. It can also be married with different kinds of topical acids like tricloracetic acid for an intense treatment, or salicylic acid, or tranexamic acid for pigmentation. There's a lot of different variations that we do to treat pigmentation or melasma or scarring, depending what we want to accomplish. It's really versatile. It's very minimally invasive, only in that it does go through the barrier of the skin. So you will have some downtime of redness. Depending how deep we go, that can last for 1 day to 3 days. And again, depending on what we combine it with, you could have some peeling that happens and some resurfacing of the skin. Lots of variety and lots of different reasons to get microneedling. So if you're curious whether it is the right treatment for your skin, shout out on our social media and reach out to us on our website, and we will make sure that you see someone in consultation.